Welcome everybody to Go Local Live. It is 12 noon, which means Dr. Michael Fine time. Couple quick programming notes. Want to thank Zach Levesque from North Point for joining us at the 10 o'clock hour. A lot of good insights into where the financial markets are and where Rhode Island's real estate and mortgage markets may be. 1 o'clock we'll have Governor Raimondo's presentation. Again, she's refusing to allow journalists to ask questions live so that the public can hear it. And then at 3 o'clock, political scientist from University of Virginia, Jennifer Lawless, will join us. Update on the Biden race, the Sanders endorsement, the president's performances, and how the governors are mounting an effort to take on the president from a political standpoint. Let's go to Dr. Michael Fine. Dr. Fine, thanks so much for joining us.
Good afternoon. Good to be here.
Okay, let's go right into the numbers today. What do we got? What do we know?
Well, the most important numbers to me are the Rhode Island numbers, which continue to be very impressive. The growth in our hospital and ICU bed usage, actually those have been flat for a couple of days. And, one day is just one day. I want to see what happens with this over 3 or 4 days, but boy, I hope this trend continues. Around the world, there are 1.949 million people who have been tested and infected. That will cross 2 million sometime today. It's probably just a shadow of the total number, which is probably 100 or 200 million around the world. Growing pretty stably, but not growing exponentially. So, sort of stable. We're seeing an extra 65, 70,000 new tested cases a day. In the United States, we're up at 588,000. People will cross 600,000 sometime today. Again, growing for the moment stably at about 25 or 26,000 a day. In terms of deaths, we're at 121, almost 122,000 deaths around the world. Also growing stably at about 6,000 a day. In the United States, we're at 23,727, growing at about 1,600 a day. So we'll cross 25,000 sometime in the next 24 hours.
And what do those numbers tell you? We're not seeing any massive surges at any of the major data numbers, but we are continuing to see pretty consistent growth. Almost you can measure it day by day, correct?
Yeah, what's impressive to me is that the rate of growth seems reasonably stable. We're seeing growth, but the rate of growth hasn't exploded. And what I look out for is that exponential change, which thank goodness we have not seen, or are not seeing, at least at present. And in Rhode Island, we're doing, at least in the hospital and ICU numbers, perhaps even better than that.
Dr. Fine, yesterday there was the majority of testing in Rhode Island was shut down. It's outdoor. There were severe weather warnings, and in fact, severe weather. They should be back testing today. Is that our best strategy to continue that? And especially with no racial data coming out to be able to identify from a demography standpoint where the resources should be focused on, where the education should be focused on, because we don't know where anybody lives and we don't really know who's at risk.
Well, it's the conventional strategy. And I know the governor is working hard to get new testing stations open in places that are at risk. Those haven't happened yet. I would love to see the data you're talking about to let us know where our problems are from a locality perspective, from an income perspective, and from a race and culture perspective, but we just don't have those numbers yet.
We're 6 weeks into it. At what point does it just not matter anymore?
Well, I think we're actually getting close to where testing may not have as much influence as people wanted, and even where contact tracing may not have as much influence as people wanted. I think they were incredibly useful 3 and 4 weeks ago when we were trying to stop the spread of this pandemic. But right now we're in an interesting place. And that is, we now have begun to understand that the virus is essentially everywhere, and that everyone is potentially exposed. And so I think our challenge at this moment becomes managing symptomatic people, who are the people most able to not only spread the disease, but spread it with enough volume that it creates danger for other people. The flip side is, and again, it's way too early to tell, and I don't have any science behind this, but the flip side is we may have an unintended positive impact of social distancing. And that's beginning to look like we may have shrunk the number of people who are getting severely ill, and particularly who get ill young. We don't have yet a published compilation of number of hospitalized cases by age, I'm sorry. But what I'm hearing about the deaths by age is that we just haven't had the number of deaths in younger people that they've seen in some other very severely affected places. And that tells me that social distancing probably had a really interesting effect. And I'm really also interested in seeing how it's affected the prevalence of immunity in the community. I'd love to know whether we're 5% immune, 10% immune, 30% immune, and certainly we want to know the moment we hit 60% immune, because that's when we can think about opening up from a safety perspective.
On the contact tracing issue, that was important first week of March, second week of March. We didn't do it. We didn't have the data. We didn't have an infrastructure built to collect the data. And now it seems like it's a math question. It seems a bit of a fool's errand. The manifestation of how long it takes to incubate. We don't know about asymptomatic folks. You'd have to trace back 3 weeks everywhere anybody was. It just seems like there's no possibility that the Department of Health and the National Guard and the state police would have enough resources to be able to make any meaningful difference in identifying and tracking through all that data.
Yeah, that's a kind of interesting public health problem. I mean, first of all, we definitely were doing contact tracing as best we could in early March. My colleagues at the Department of Health rolled their sleeves up and got to it and did it fantastically. The problem was we just didn't have enough testing to know who all the positives really were. Currently, I think you're right, contact tracing really relies on the notion that we can isolate and prevent the spread of the disease. And I think this disease is teaching us something about itself every day. I think it's teaching us that it's going to spread in any closed space. Any house that's got a case, everyone's going to be infected, and we have to assume that everybody's exposed. So I'm not myself convinced that contact tracing is going to pay the dividends that we thought it might, but I think we do have to really compliment the folks who figured out social distancing and the intensity with which we applied it, which really looks to me like it has significantly blunted the spread of this disease and saved lives.
Okay, so let's narrow this down. We've had these conversations between the two of us. We've looked at a lot of data. You actually have expertise. I just read data. If social distancing now looks like it's the key to the success in minimizing the impact, then these announcements, both by the president and by governors talking about bringing people back to work, would therefore break down the strategy that has been most effective.
Well, two things. First of all, social distancing, and in my view, plus isolation of symptomatic cases. Something we haven't really started with precision in the way that it's been done well in other places. But that said, I don't know how we can understand when to phase out social distancing because we don't yet know what the community, what I call the prevalence of immunity is. when, like I said, when 20% of us are immune, the disease is going to spread. When 60 to 70% of us are immune, perhaps not. And as we get beyond 70, likely not. The challenge is how we know, we just don't know. And until we know that, I think how we choose to phase out social distancing is anybody's guess.
There's a lot of discussion about use of data, tracking data from cell phones. Google and others have, and Apple have proposed strategies. Unicast does tracking. The governor seems to have some other source of tracking. Unicast gives Rhode Island a D+. The governor says, oh no, we're doing much better. And then there's folks like the ACLU are raising real privacy concerns. Where are we on this use of data? What should we be looking at? And where does privacy come into it?
Well, I think all of that makes the assumption that what matters is exposure, not what I'll call host immunocompetence or viral load. And I'm not convinced, as we sit right now, understanding some new science about how the disease is transmitted, how easily it's transmitted, I'm not convinced that exposure really is the big determinant. I think the big determinants are host immunocompetence and viral load. I don't have any science behind that, but that's my sense looking at the numbers. If that's the case, all the, like figuring out who's been in contact with who doesn't really matter for very much, because we got to assume the virus is pretty much everywhere and act accordingly. And so, I get the ACLU's concern about privacy, not for this outbreak, but certainly for other stuff as we go forward in society. I also have to be realistic and understand that there isn't much privacy in the world anymore with our electronic infrastructure, as much as we might want it. That may be a false belief and a false.
When you signed up for Facebook, you pretty much gave away all your privacy. For any poor person who's watching this and trying to understand, okay, when is it safe to go outside? You get this anecdotal information out of South Korea over the weekend that at least 91 individuals who had tested positive before and then recovered are now testing positive again. Another curveball by this virus.
I want to see the science on that. I saw that report, but I want to see the science on that before I draw any conclusions from it. There are a whole different set of ways of spinning the same observation, and I'd like it to be analyzed rigorously before we draw any conclusion from it whatsoever. For the moment, the correct choice is to stay home, to stay away from other people, and to get into an isolated room, stay by yourself if you get sick. The rules are the same. The rules haven't changed one iota for the present, nor do I think they will, at least for the next couple of weeks.
To come back to work, to be able to reestablish the economy, to function in schools and education, do we almost need to build an infrastructure in that every person can test themselves on a daily basis?
Well, I think we ought to first make sure we test everyone who wants to come back to work to see if they're immune. And once you're immune, you don't need to test yourself. For people who are working, perhaps as we get more sort of simple self-swabbing technologies, once we prove they're effective. I'm hearing, because of my work in Central Falls, I'm hearing from people who are working every day and working in factories and are working close together, not always masked, working, often are told that they might take a day out if they're sick, but if more than that, they need to come back or they're going to lose their job. I'm really concerned about that kind of work, and we need to put a stop to that before we even think about opening up more.
Well, listen, you've seen the cases, the USS Theodore Roosevelt, 600 sailors testing positive, a major pork facility, 300 workers testing positive. The country doesn't seem to have a very strong workforce, workplace strategy to be able to protect workers from being exposed at the workplace. And then, of course, going home to their families and infecting them as well.
And that's the concern. I mean, that's where we need real enforcement on the Department of Labor side, both at the federal and state level. OSHA has always been a strong proponent of workplace safety. We need OSHA to step to the table and be present everywhere for anytime anyone's going to be going back to work.
So to wrap up, your lesson of the day is what should be the going forward strategy in your mind?
Well, first, remember we've done exceptionally well with social distancing. The go forward strategy to me is to find a way to identify everyone who's sick and symptomatic and make sure that every person who's sick and symptomatic is in appropriate isolation. And then beginning the process of community serologic surveying, testing samples of communities to see who is immune, so we know when the level of immunity makes it safe, at least in those communities, to begin to open up again.
Dr. Michael Fine, thank you very much. Thank you for your expertise and your almost nonstop research on this. Viewers, I get emails, video clips, working papers, finished papers from all over the globe from Dr. Fine, literally on a 24-hour basis as he continues to dig into this and share his expertise. For everybody else, 1 o'clock, the governor will give her presentation. 3 o'clock, Jennifer Lawless back on GoLocal Live, talking about the politics of America today. Thanks, everybody, for tuning in.
Thank you, Judge.